Hey everyone, we've got another specimen today. This is number 1192 in our collection. The heart would have set roughly in the chest like this, anterior surface here, posterior surface towards the turntable, superior head up here, inferior legs down here, left over here, right over here. Generally, we start off by looking for the right atrial appendage. Fortunately, you can see that there is no right atrial appendage or left atrial appendage on this heart at the moment, and that largely the right and the left atriums have been removed because this, in fact, is an explanted heart, and this child did undergo a transplant at our institution. Nonetheless, we do know that this is going to be the right atrium here. So the right atrium, you can see its remnant right here. And then this is, in fact, a right-sided AV valve. It does appear to have 3 leaflets, 1, 2, 3. And it does have septal connections, consistent with a morphologic tricuspid valve. Now, when we look at this anterosuperior leaflet, you can see that there, in fact, is an incision. This was not made, this was not incidental, this was, in fact, there when this heart was explanted. And this child does, in fact, have a cleft in the anterosuperior leaflet of the tricuspid valve. One could see how this could be a mechanism for significant regurgitation across the tricuspid valve during life. Here's the septal leaflet connected to the septum here, and then here's the inferior leaflet. You can see this tricuspid valve looks relatively large. There is a ventricle here that has coarse trabeculations. It does appear to have a septomarginal trabeculation consistent with the morphologic right ventricle. And then here we come across a valve that is a semilunar valve. It has been also a little cut away, but there appear to be 3 leaflets. And this was, in fact, the native pulmonary valve in this heart. Now, when we go to the posterior aspect of this heart, the left atrium would have been right here. When we open the left side of the heart, we can immediately see what is going on here. There's a small left ventricular cavity, which is much smaller than the right ventricular cavity, so we are dealing with a version of hypoplastic left heart syndrome, or HLHS. Here's a left-sided atrioventricular valve that appears to have 2 leaflets, 1 and 2. Okay. So it does appear to be a morphologic mitral valve, as it also does not have direct connections to the ventricular septum here. Here is the posterior leaflet, and here is the anterior leaflet of the mitral valve. So you can see a highly abnormal mitral valve. It's not only small, but the anterior-posterior valve size discrepancy is a little exaggerated in this heart as well. So far it looks like we're dealing with a heart that at least has HLHS with mitral stenosis. Here's the small left ventricle. Here's the left ventricular outflow tract, and here is another semilunar valve. Once again, to remember that the semilunar valves don't actually truly have a round or oval annulus. What we call the annulus from an echocardiographic or CT standpoint is a man-made structure. The true annulus in these valves is actually crown-shaped or semilunar if you have it, and what we refer to as the annulus is perhaps better referred to as the basal plane, and that is a helpful structure by all means and does help us in surgical planning, but the true annulus is actually in fact crown-shaped because there are interleaflet triangles that interpose between the valvular leaflets, and the interleaflet triangles in the semilunar valves are actually muscular and not fibrous like the valvular components themselves. Nonetheless, we have a 3-leaflet aortic valve here. There's a coronary artery here, and here's another coronary artery rising back here. So all consistent with hypoplastic left heart syndrome with mitral stenosis, aortic stenosis. You can see the small left ventricle here, and obviously the intact ventricular septum. There is no ventricular septal defect seen from the left, and certainly no ventricular septal defect appreciated from the right either. So once again, here's the tricuspid valve. There's a large cleft in the anterosuperior leaflet. Here's a morphologic right ventricle with an intact ventricular septum. Then we go to the back. We find a mitral valve that's certainly smaller. We find a left ventricle that's certainly smaller. We find an aortic valve that's actually of reasonable size, gives rise to coronary arteries. So we are dealing with hypoplastic left heart syndrome with mitral stenosis, aortic stenosis. This child did undergo stage palliation all the way through a Fontan and then underwent a transplant. But an interesting heart, as there is a cleft in the tricuspid valve, and to note that a cleft and commissure are not the same thing, and that a cleft occurs within the valve leaflet itself, such that the area immediately surrounding it is flail and unsupported, unlike a commissure, which here would be a commissure or a zone of apposition, which isn't flail. And so here the anterosuperior leaflet is two components, one here and one here, and obviously this cleft